So we've all heard of pediatricians, right? They specialize in treating kids.
What about a geriatric doctor?
Those are doctors who specialize in an aging population, specifically for people over the age of 80.
Yeah, that's pretty incredible. Melissa Coll visited UConn Health to learn more about this specialty. Take a look.
I will be 88 in a couple of months.
Oh, you look great.
I do? Thank you.
Annie King of Bristol is a patient of Dr. Patrick Coll at the Center on Aging at UConn Health. She started coming here in her 70s after a colon cancer diagnosis.
When she had her surgery, I was worried about her nutrition. She had fairly major surgery, so we worked with her very, very closely on her nutrition and also her strength. And now, 8 years later, 7 years later, she shows the value of that effort. You know, she's still very independent, she's still very vibrant.
Dr. Coll is the medical director for senior health at UConn Health.
I think the best way to think of geriatrics, it's like pediatrics is a specialty for children and younger adults. Geriatrics is a specialty for older adults. And we're a little bit different in as far as we do both primary care, but we also do specialty care.
A big part of what doctors do here is helping seniors maintain their independence.
That's a big part of our emphasis, is to try and work with our patients so they remain as independent as possible and as healthy as possible for as long as possible.
Following healthy nutrition guidelines and exercise, both walking and strength training, are some of the things patients are encouraged to do regularly.
And that's it, exercise as much as I can. I'm not a winter person, so I don't get outside to walk as much as I should. But it's better when it gets warmer.
So we're seeing a lot more older adults living into their 70s, 80s, 90s, and we probably have, I would say, 20 or 30 patients in our practice who are over 100.
Wow.
Yeah, absolutely.
Dr. Eileen Pangelinen also works at the Center on Aging, where an annual wellness screening is part of the protocol.
An annual wellness visit basically tries to look into trying to screen for problems before they happen and trying to come up with a solution before it becomes a full-blown problem or a full diagnosis. So we try to anticipate what the issues are that you could have when you're aging, and we try to look for those issues before they do happen by questions and by some objective measures, and we try to come up with a plan for those.
And you're also a great example of resilience because, you know, you had your colon cancer 7 years ago and you were, you know, you had major surgery, but you bounced back. You were resilient and you're living proof of it now.
I think everybody here is wonderful. No, it's just assurance, I guess, when I come here, that I'm still here, I'm doing okay.
Good for her.
She certainly is, yeah. And you know, it's great to just have specialists like this right here in Connecticut. So visit health.uconn.edu/aging.